Imagine feeling perfectly healthy, but inside your liver is quietly under attack. Every single day, over 1 million people around the world live with hepatitis without even knowing it. These silent viruses can spread through food, blood, unsafe sex, and also even from mother to baby. But here's the good news. With right knowledge, most cases are completely preventable, and some of them are even curable. I'm Dr. Motahare, and in this video, I will simplify everything you need to know about hepatitis. Let's dive in. What is hepatitis? Hepatitis simply means the inflammation of the liver. It can be caused by many things like viruses, alcohol, medications, or even autoimmune causes. But when we speaking about viral hepatitis, we just focus on viral causes of hepatitis, mainly hepatitis A, B, and C. Understanding which type you are dealing with, it's important because each of them behaves differently, and also treatment options and prevention options are different. Hepatitis is a major global health challenge. Each year, about 1.5 million people develop symptoms of hepatitis A around the world, mostly in the areas with poor sanitation. Hepatitis B is the most widespread chronic infection, affecting nearly 300 million people around the world. And hepatitis C chronically infects almost 60 million people worldwide. Many don't even know they are infected, making early detection and awareness critical. Here is a quick comparison. Hepatitis A is an RNA virus transmitted through contaminated water and food. It's short-term, self-limited, and preventable with a vaccine. With a long-term immunity. Hepatitis B is a DNA virus, spread through blood, sexual transmission, and even from mother to baby. It can become chronic, but again, we have a vaccine for that. Hepatitis C is another RNA virus, mostly transmitted through blood. It can become chronic and cause serious liver damage. But there is no vaccine for that. We can just prevent it, or with early detection, treat it. So hepatitis A is spread when someone ingests the virus through contaminated food or water. Hepatitis B is more serious and transmitted through blood and bodily fluids. Blood transfusion, sexual contacts, sharing needles, and also from mother to baby. Hepatitis C mainly is spread through blood contact from unsafe injections or blood transfusion, and rarely from mother to child or from sexual contact. So what are the signs and symptoms of hepatitis? In the earliest stages, it might look like a flu, fatigue, loss of appetite, nausea, joint pain, low-grade fever, like that. As the liver damage progresses, you can see the yellow discoloration of skin and also eyes. You can see the dark urine, pale stool, and other symptoms like pruritus. But in many chronic cases of hepatitis B and C, people have no symptoms at all until the liver damage has already progressed until the liver is seriously damaged. They are silent. Diagnosis is done through some blood tests. For hepatitis A, we are looking for antibodies. IgM for recent infection, or IgG for past infection or immunity. For hepatitis B, we have many tests based on what we are looking for. We will order them. But as a general HBs antigen will tell us about active infection, while HBs antibody is about immunity or past infection, which completely resolved. And also, sometimes we are looking for HBV DNA for confirmation of viral activity. For hepatitis C, first, we are looking for anti-HCV antibodies. When it's positive, then for confirmation, we need to do HCV RNA PCR. That means that we are looking for RNA of that virus in the patient's blood for confirmation. We need that. We cannot make a diagnosis just based on that antibodies for HCV. So for HIV, we are looking for anti-HIV antibodies, IgM, IgG. For HBs, we have a set of different immunology tests, and also we have HBV DNA PCR. And for HCV, first we will look for anti-HCV antibody, and after that we will confirm the diagnosis with PCR, looking for RNA of that patient's that virus in the patient blood. What are the treatment options? Hepatitis A usually clears up on its own. We just need to provide supportive care, rest, fluids, and things like that. Hepatitis B is more complex. While some cases resolves, chronic infections may need antiviral therapy to control viral replication and protect the liver. Hepatitis C used to be a lifelong condition, but fortunately today, with new antiviral drugs, we can cure more than 95% of patients with just a few months of treatment. Hepatitis A doesn't become chronic and almost always ends in complete recovery. But both hepatitis B and C can turn into chronic infection, leading to long-term liver inflammation, fibrosis, cirrhosis, or even liver cancer. That's why screening, early detection, early treatment, and vaccination are so important. They save lives. Prevention is always better than cure. For hepatitis A, vaccination and proper hygiene, like washing hands and eating clean foods, are key. For hepatitis B, again, vaccination is very important. Plus, practice safe sex and also avoid needle sharing. Anything that will increase the risk of blood contamination, two people blood contamination. For hepatitis C, unfortunately, we don't have any vaccination yet. So we should focus on safe injections and blood screening, and also awareness. We should know that how to protect ourselves from getting involved with HCV or HBV infections. Let's summarize. Hepatitis A spreads through food and water and never becomes chronic. Hepatitis B spreads through blood, sex, and from mother to baby. And we can prevent it with very good vaccination. Hepatitis C spreads through blood, has no vaccination yet, but now is curable. Knowledge, vaccination, and safe practices can eliminate these infections over the time. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with your friends and colleagues. Subscribe to the Art of Medicine with Dr. Motahare for more simple, evidence-based explanation of complex medical topics. Stay informed, stay healthy, and see you in the next video.